Welcome to Talk with Jeff 360. Today we're going to be talking about COVID. This is like a special episode because I have somebody special here next to me, and this is my wife.
Hello, my name is Esther Huggins. Good evening, everyone.
Welcome, Mrs. Esther Huggins, to the show.
Thank you.
All right, so we're going to talk about COVID. And before we start, guys, subscribe, share it, turn on your notification because I have a lot of different interesting things coming up. Like today, we're going to talk about COVID. All right. So, anyways, so after 6 months of trying to get my wife here, she finally got it going. Yes, yes. All right. Awesome. So, anyways, well, I guess you people want to know why I ask you to be part of the show.
So I'm here because I'm a nurse practitioner. I have been working as an adult health nurse practitioner for the past 6 years, and I've been an RN for the past 15 years. I also worked during the COVID pandemic. I work in a long-term care facility, which was ground zero for many COVID cases. So I have a lot of experience that I have firsthand regarding COVID.
Okay, so before we begin with everything, I just want to emphasize on something. Okay, COVID, we can talk a lot about COVID, like the financial aspect, how it has affected the nation, the world financially, the future of finance, due to COVID, social media, social impact. Now you have to enter certain places with your card and things like that. The conspiracy theories. But today, I want to center on a public health crisis, because we want to center on that because this is what we're going through now. Okay, I think it's the most important thing. So I'm gonna try, because I have a lot of questions, I have a lot I want to say, but I'm gonna try to do my best to focus on this public health crisis. Okay, so I've had COVID, and I don't think you had COVID.
No, I did not.
Okay, so I have personally experienced this sickness myself. All right. So it was painful. It was painful for quite some days. I was going through a lot of pain, high fever, muscle ache, and all that stuff. And I can even imagine people who had respiratory issues. We all know that we're not going to go and talk about these things again, but we all know that a lot of people have also died from COVID worldwide. Big deal, worldwide. So, as a professional and personally, you seen me sick and you were not infected by it, but what are your thoughts personally and professionally on COVID?
Professionally, my thoughts on COVID is that it's a very serious illness. It's a virus. Once contracted, if you have comorbidities, they make the illness portion 10 times worse, which is why our residents in the nursing homes experienced it at its worst.
Okay, wait, you said comorbidities?
Yeah, comorbidities meaning other illnesses, especially diabetes, hypertension, heart disease. If you are prone to blood clots, because with the COVID virus, or when you have the infection, one of the presentations is blood clots. At a certain point, the body would just start to create diffuse clots like all over your body. And I've seen patients that had heart attacks, which a heart attack is a clot in your heart. Just a bunch of different complications.
Okay, so like I've mentioned before, a lot of people have died from COVID, and it was a disaster. And I think it's still a disaster because we're still dealing with the after effect, prevention from it happening again, and all that stuff. Have you, in my lifetime, I've never experienced anything like this. I've never seen anything like that. I've heard of, certain other disease in the past. But what about you? What are your thoughts on this?
My thoughts as a nurse, the only thing I experienced, two things. During H1N1, I worked as a floor nurse, and, there was a lot of fear that it would have reached to this level, but it never came to pass. It was an H1N1 vaccine that we ended up having to take. Many people fought it, similar to what's going on now, but it was nothing compared to this. The other thing is I worked in the ER during the Ebola crisis. Now that, we prepared ourselves. There were mock Ebola patients that would come through the ER. There was a lot more preparation because we had more time. COVID really hit us very quickly and acutely. So there was less time for preparation, but the only thing I can compare it to is Ebola, in the sense that heightened fear and just the fact that it was a virus as well. But definitely, as you said, we've never seen anything like this in our lifetime.
Okay, so some of the statements I'm going to make, I have to let you know, guys, I am not a scientist, but based on my observation and what I understand, I'll make those statements. And perhaps, Esther is going to say, no, that's not what it is. Because I have to be honest with this. I don't think, because when you hear Ebola, even the name, it sounds like crazy and scary. And I don't think Ebola is as dangerous and crazy as COVID. Like, this thing that has affected us like worldwide is, and people have died like really, really, really quick from. Okay, so in addition, you said something that I don't want to go political on there either, but you said we didn't have enough time to prepare. I personally don't agree, because I think that there could have been a better way to deal with it from the beginning, which, because unfortunately the previous administration did not approach it properly. And this is something we have to agree on. Like, I mean, you don't have to agree on it, but there was a lot of disbelief from the previous administration that, oh, it's going to go away in the fall. It's going to be there just for the summer. Yeah, it did not. And look what happened. So I think that we had the time, but there was a lack of preparation. Again, I don't want to go political on this, because the subject here is a public health crisis. Okay, it's a public health crisis. Now,
well, I just want to quickly say I agree that, so we did not have enough time is sort of subjective almost. The time that we had may not have been used in the best way to somewhat prepare us. We were somewhat reactionary.
Okay.
So there's that aspect. Like you said, without getting too political about it, I'll just say we didn't have enough time, because that administration would have needed much more time to create the outcome that we may have been able to, I don't know, be a little more prepared.
Okay. All right. So back to the subject now. So people are infected with COVID. What's the fastest time you've seen people die from it?
So I would say, while caring for patients, I would say within 5 days, like, they would start with a fever and then, progress to maybe a cough and just generalized malaise and fatigue. But when the infection really reached its like peak, within 24 hours, we were having to transfer patients out into the emergency room because we couldn't sustain them any longer. They had what's called ARDS, which is acute respiratory distress syndrome, where like it's complete lung collapse. They were unable to breathe. We couldn't maintain them on the oxygen that we had. At that point, they would have needed to be intubated.
All right. By the way, I want to send a big shout out to all our nurses, to you and the brave nurses and doctors and everyone, for every first responders who worked in the hospital. And I'm telling you,
Definitely.
I'm getting emotional right now because a lot of people were dying. A lot of nurses were infected. Doctors, they died. And we ought to remember them. They still came out and say, I am going to do what I love, is to help, is to save. And it kind of gives me hope about humanity, because we hear a lot of bad things happening out there, a lot of crazy things. And sometimes we like, where is God? Where is the goodness in people? I'm asking you guys to remember these people. All right? Because putting yourself in like front line is a big deal. Is a major sacrifice, because not only you're putting yourself in danger, and and you're not dreaming of it. You know the consequence of this and how it can happen. And unfortunately, we lost a lot of nurses, doctors, and first responders, other first responders who've tried, who've put themselves, like second and say, something, I'm going to do my job. So yes, I just want to quickly mention that. So now we have another situation here. We have another crisis, and I'm going to call it crisis, the vaccine. Why am I calling the vaccine a crisis? Because now we have a lot of people who don't want to take the vaccine. Did you take the vaccine?
I did.
Okay. So I also took the vaccine. Now I'm going to tell you why I took the vaccine. I took the vaccine because from my personal experience with COVID, even though they talked about, you have antibodies and stuff like that, I said I have to be a little bit more responsible. I have my mother-in-law, we all live together. So I'm saying to myself, I don't want to be that guy. I don't want to be the guy to bring it to her, because I'm out there all the time. So I wanted to get that off my mind. And I wanted to make sure, and especially knowing that my wife wasn't infected either, I said, I have to make sure she doesn't get it from me either, because especially she's already working in a place where there's a lot of sick people. So I did not want to be that guy. So I kind of became selfless, though I am not, or was not, and still have a lot of question about, the vaccines. Not gullible about it. All right. I have a lot of questions, but hopefully along the way, we're going to learn these things, and we will see that it was for the good of humanity. These things were happening. And unfortunately, of course, as I've mentioned before, we dealt with a political situation that really affected us, with not only COVID, because a lot of people were in disbelief. They did not want to believe, right? They did not want to believe this thing was happening.
Yeah.
It's not COVID. It's just fake, blah, blah, blah. It's Illuminati.
It was out of sight, out of mind.
Yeah.
For those of us who firsthand had relatives that got sick or got sick ourselves, knew someone who died, COVID was real. But for some people who were fortunate enough not to have to go deal with that, there was questions like, oh, well, we hear about COVID, but we don't see COVID.
Yeah. G5, Illuminati, all that stuff. Okay. So, but now let's get into the vaccine. Vaccine's been there for a while, right? What's the importance, or if it is important in our society? Tell us a little bit about vaccines.
So vaccines have been around for a very long time. There's the polio vaccine, there's the tetanus. There are different vaccines that have helped smallpox, help to eradicate or pretty much diminish certain diseases to a level where they're pretty much unseen. Diseases that were once plaguing us, similar to COVID. So vaccines are important because when you get enough people vaccinated, you get what's called herd immunity, and then these types of diseases aren't able to run rampant anymore. So the COVID vaccine is now our new challenge to deal with the COVID virus that is among us right now.
Okay, so are you saying it's important to take the vaccine?
I do think that it's important to take the vaccine. Of course, considering like when you speak with your doctor, if there are reasons why you should not take the vaccine, that is something to consider. However, the COVID vaccine is different so there are some vaccines that that use eggs or portions of egg in order to create the vaccine. So for some people, they couldn't take that vaccine if they're allergic to eggs. The COVID vaccine does not have any of that. So that's not a reason not to take the vaccine. So the COVID vaccine is an mRNA, well, the Pfizer and Moderna mRNA vaccines, and they're different.
Okay, so they're different. And can you tell me a little bit about the difference?
So the difference is that, with previous vaccines, there would be an attenuated version of the virus or bacteria that they use to create the vaccine, and they would inoculate you with it. And then that would then introduce the virus to your immune system, and your body would then know how to react when faced with the actual virus. So the COVID vaccine is created with mRNA, which takes a portion of the virus. A portion of the virus is introduced into your body via vaccination. And with Pfizer, for instance, there are 2 doses. The first dose is very mild, and it introduces the protein into your body, and your body then recognizes it. So now when you get the second shot that many people have experienced a reaction to, is because your body has started to develop immunity. And so you get that immune response. So when you have a fever, when you have a body ache, it's a good thing. It means that the vaccine is actually working and your body recognizes this protein and is ready to fight it. So now if in the real world scenario, you come in contact with the COVID, your body is ready to fight it. And even if you are to get the virus, you wouldn't get the infection and complications that others have had to face.
All right, guys, I got to quickly mention, as we're talking about pharmacies and vaccines and all that good stuff, this is my show. I'm not getting paid from anyone to say anything. If it appears that I am pushing or encouraging people to take the vaccine, it's my personal opinion. Or if Esther is saying anything about the vaccine, personal and professional opinion. All right. Like I said, again, I have a lot of questions concerning this entire situation. There's a lot of things I want to say, but because we're talking about public health, we're going to stay on public health. All right. So
I think we both had questions before we actually decided to take the vaccine. We were like, although we are working professionals, we had questions as well. This was all new for us. Like, the vaccine was manufactured quicker. There were a lot of different things about, and it was highly publicized.
And for instance, the origin of COVID, I'm still asking questions. I need to know. I need to know what's up. But anyway, so now we have vaccines now. People are taking the vaccine. You've taken it. I've taken it. Does the public have the right to question, doubt, and refuse to take the vaccine? Because let me tell you, major companies, agencies are firing people. Even the very people that were frontline working to save others. Major people, like these companies are firing a lot of people, mandating the vaccine. But does the public have the right to ask questions, to doubt, and to refuse to take the vaccine?
I think they do. Like I said, during the time I worked as a nurse and H1N1 came around, a group of nurses got together and they refused the vaccine then. And all of a sudden, we didn't hear anything about it. COVID is different in the sense that it's been around. We've been dealing with COVID since 2019. So the reason why the government the government is mandating these private agencies to mandate the vaccine because truthfully, many companies would, it wouldn't be a thing for them. Like whether you want to get the vaccine or not would be your personal choice. But because the government is mandating them, they have to fall in line as well. Does the public have the right to refuse? Absolutely. I think it's important, just like conversation, discourse, it's important to have both sides. If everyone just said, oh, vaccine, yeah, I'm taking it, no questions asked, who knows? It wouldn't be as stringent. They wouldn't be as careful. This is all a part of the process.
Okay. And one of my things, one good way I can see it is that I think this administration, I am not talking on behalf of the administration, they wouldn't want this chaos to happen again. And please, guys, I want you to remember, everything was shut down. You couldn't go to a restaurant. You couldn't see friends and families. You couldn't hug certain people in your life. You just had to be on the phone. It was a very, very big crisis. And a lot of businesses were shut down. Some are still recovering. Some will never recover. Okay. So my personal opinion on it is that I think that they're really working for it not to happen again. Believing that these vaccines do work. I took the vaccine. I don't know if the vaccine works. I'm going to tell you straight up. I don't know if it's working right now, but I hope it's working. Now, I have to put my faith in the hands of those scientists and doctors. All right? So
I would say I think the vaccine is actually working because the numbers have decreased. So yes, there are some people who, despite having been vaccinated, will test positive for COVID. But it's a very small number that actually become ill because, if you have asymptomatic COVID, that's one thing, and you can spread it to someone who can potentially become ill. But I think the main issue is when you become ill and die from COVID is what we're trying to prevent. Because if it was just another virus like the rhinovirus, which is for the common cold, everyone gets a cold and you're able to get over it, we wouldn't be as concerned. We don't have to get a vaccination for the rhinovirus. It's the fact that so many lives were lost and could potentially be lost due to COVID.
Okay. Again, we are in a public health crisis, not only with COVID right now, but also with the vaccine. And in the grand scheme of it all, the way I see it is I want to keep on moving. I want the world to keep on moving. I want us to be better. I want us to feel good. I don't want to be around sick people, especially something that can kill you in 5 days. I wouldn't want to get this joint again. All right. So at the end of the day, it's your decision, but you take the time to think about what you've gone through, what our society has gone through, and how you can help to prevent it from happening again. Because you may think that you're not a part of it because you never gotten sick, but let's assume that you were to pass it on to somebody else. You know, oh, spoiler alert. I'm about to like spoil the movie for you right now. 007 if you haven't seen it. So if you haven't seen it,
don't.
Okay. I watched this film, and I've seen many films before like that, where it's a biological weapon that came out, and it's designed to to attack a group of people. But this one was very, very well designed, and it was designed to the point where you could carry it, you don't even know, and when it reaches the intended target, bam. Mm-hmm. So just think of it that way. You may never get sick, but you may pass it on to somebody else. So it's a big deal. It's a crisis. Just if we were to find ourselves in that situation again, we would lose a lot more, from people to businesses to just a lot. This is going to affect us on every single level, structure in our lifetime. So I think that's all I have to say. This is a health crisis, and we ought to figure this thing out one way or another. Any last thing you want to say?
My last words, definitely COVID has changed the world. Like you said, financially, the healthcare system has definitely changed due to COVID. And although we want to go back to normal, I think similar to post 9/11, the way travel changed, post COVID, there are some changes that will be here to stay.
Yep, permanent.
And probably for the better.
Yeah, probably for the better.
Probably for the better. But in order to move forward, I think it's important to think about the thing, like whether your decision will affect others, and what's beneficial for you. Definitely get in touch with your primary physicians. Take your health seriously. Like, despite COVID, COVID was very deadly for people who had comorbidities, as I mentioned earlier. So if you know you have a family history of diabetes or heart disease, hypertension, get your annual checkup. Know your numbers. Find out, is your A1C rising? Exercise. Exercise helps so many different things that, implement that into your life and stay safe.
Yeah, I love to exercise, and I'll be talking about that a lot. But it definitely, there's a magic into taking care of yourself. I'm telling you. I am telling you, and it doesn't matter how old you are. If you have young kids, start educating them on staying healthy, being healthy, on moving around, exercising. All right. So
take your vitamin D. Vitamin D was definitely helpful throughout preventing COVID, and it's good for you in general.
Awesome. Well, thank you for coming to the show and talk to us concerning COVID.
Thank you for having me.
Now, but you have to promise still to come back, because there are different things we can talk about, health-wise, and I think that the people want to hear, and I'm trying to make this show good and different and unique, and I'm going to need your help on this.
Yeah, I'll be back. We'll make it great.
Awesome. Amazing. Thank you, guys. Please subscribe and share again, and
hit the like button, get the notifications. Talk with Jeff 360.
Awesome. All right. Bye.